This is Rob Ferre, an emergency medicine physician and point-of-care ultrasound enthusiast. In this second module on hydronephrosis, we're going to discuss how to determine the degree of hydronephrosis. We previously discussed how to determine if hydronephrosis is present. In this module, we are going to learn how to determine the degree of hydronephrosis. However, you may ask, does the degree of hydronephrosis matter? Well, yes, it does matter. And it may surprise you that it is more important that you can determine if the hydronephrosis is severe. I will tell you why that is in just a moment. But first, what exactly are you looking for to grade hydronephrosis? Remember, as we previously discussed, there are two distinct sonographic zones with ultrasound, the outer renal parenchyma and the inner renal sinus. As a quick review, urine is made in the renal cortex, flows down the renal pyramid and into the minor calyces. 2 to 3 minor calyces converge to form a major calyx. The kidney has about 2 or 3 of these major calyces that then form the renal pelvis. Urine then exits the renal pelvis and flows down the ureter to the bladder. When an obstruction occurs, the urine first builds up within the renal pelvis. On ultrasound, this is seen as an anechoic area near the renal hilum. As urine continues to collect within the renal pelvis, the major calyces begin to fill with urine. If the obstruction is not relieved, more urine will fill and collect within the renal sinus, until the minor calyces are also distended. Again, mild hydronephrosis is characterized by buildup of urine in the renal pelvis that extends into the major calyces. Technically speaking, urine only within the renal pelvis is also characterized as mild hydronephrosis. As urine fills both the major and then the minor calyces, we categorize this as moderate. At this point, the urine cannot distend more of the renal sinus, so it makes hydronephrosis severe. It is simply thinning of the renal cortex that occurs due to the obstruction over time. It takes time for this renal parenchyma to thin, and we're looking for a measurement of less than about 1.5 centimeters. However, I rarely measure this. Usually severe is quite obvious when you see it. Clinically, the best way to think of this is that mild and moderate hydronephrosis occur because of an acute obstruction, whereas severe hydronephrosis occurs because of chronic obstruction. This is usually due to some type of abnormality, such as a ureteral stricture or ureteral reflux. So let's look at a few examples. In this image of mild hydronephrosis, the renal sinus is distended with urine. This distension also extends to at least one of the major calyces. In this example of moderate hydronephrosis, the renal pelvis is filled with urine, and it extends to the major and even the minor calyces. However, the renal parenchyma appears to be normal in thickness. And now we have severe hydronephrosis. As with moderate hydro, the renal pelvis and the major and minor calyces are filled with urine. However, the main distinguishing feature is that it is rather difficult to even find the renal parenchyma. The entire kidney is for the most part an anechoic structure. This is severe dilation. And in fact, the normal renal architecture looks quite different than what we're used to seeing when we look at a kidney. This is because of chronic, long-standing obstruction that has caused the entire kidney to dilate and the renal parenchyma to thin. As we put these three together, you can see the difference more clearly. In mild hydronephrosis, the renal pelvis and a portion of the major calyx is filled with urine. In moderate, the kidney is obviously filled with urine as the distension extends from the renal pelvis all the way to the minor calyces. However, it is the severe obstruction that is the most obvious, in which almost the entire kidney is anechoic, and the entire renal sinus is severely dilated with thinning of the renal parenchyma.